Since I was 13 years old, I had some issues of puberty. So I have a delayed puberty. And I went to a pediatric endocrinologist. And at that time, I went there, and with that doctor, I feel like he was talking to me about hormones and how hormones can make me go to puberty and all of that kind of things, and I just felt in love of that. And I felt that hormones were like the excited world where they can do so many things. They can communicate among cells, having some issues with endocrine disorders, and then finally putting that into, I wanted to help others that have something similar in that world. I subspecialize in something called neuroendocrinology. So this area specific deal with adrenal, that is a gland that is located above the kidneys, and have certain hormones like aldosterone and cortisol problems. So I mainly see patients in that area that have some adrenal problems. I also have another passion that is seeing patients that have some issues with health disparities among obesity and diabetes, basically in the Latinx population. So I am trying to focus on creating more population-based structured things for the Latinx population that have a gap in the delivery of health based in diabetes and obesity. And the last population that I see, and I'm trying to grow that in endocrine, is the transgender population. So I do transgender medicine. The first visit is to establish what is the main concern of the patient and how we can help. So we will try to understand what are the signs and symptoms of the patient. Sometimes they can be related to an endocrine condition. And if they are related to an endocrine condition, we will find out and we will treat it. We will provide you the treatment and the resources that are necessary for dealing with that endocrine condition. The most rewarding thing is when a patient says to you, thank you. I remember prior, when patients bring you even a letter or something, it's just like, oh my God, this is what you remember why you came to medicine, because you want to provide help to others. And that just thank you of the patient, or just say, hey, you changed my life.